Hi there, this is Dr. Evan Osar with Integrative Movement System. Welcome to this edition of Integrative Movement Insider. Happy Tuesday, hope your week is started out well and you're helping to lead your community. In this special edition of Integrative Movement Insider, we're going to share with you the Integrative Movement System process. Because one of the most important things that you can do to differentiate yourself from the rest of a crowded industry is to define and share your process with your clients as well as your potential clients, so that way they understand that you're the expert, you're the specialist that they need to work with them to help solve their issues like low back pain. Because we know that many of our older clients, so this is specific to the older clients, however it generally is applicable to all populations. One of the things we see with the older population is chronic low back discomfort that often manifests in hip issues. It manifests in challenges with them being able to walk the way they need to, as well as balance issues. So one of the things that obviously we want to do with our clients is help them develop a more optimal strategy for using their core. And that leads us back to the process. So we always have an intake process with our clients where we help, or should say, where we look at and identify our client's medical history. So we want to know those things that are driving some of the underlying factors that are driving some of our clients' issues and why they have a suboptimal strategy for using their core, and then ultimately balance, walking, and all the things they need to and want to do. During the intake process, we're also helping them define and articulate to us their goals, because we want to tie everything we do with our client back to their functional goals. What are the things they really need to and or want to, and or those things that they love to do and either can't or just can't do at the level they need to and or want to. Many of our older clients, they want to live independent lives. They want to live long lives, independent lives, and have a level of well-being so they can do the things they need to, want to, and ultimately love to do. So again, back to our process. We do the intake form that gives us the background of our client's medical history. What issues are they dealing with? What are some of the compounding factors that may impact your client's core function? Things like, have they had a history of surgery, trauma, and or injuries? Because those things, as we understand, will impact how your clients are using their core. Then we want to use our assessment process to identify some of the signs of a suboptimal core strategy. And yes, there's a more optimal core strategy, way to use your core muscles, and your core, I should say, as a whole. And there's a less optimal way. Now, one of the things we'll often see, some common signs we'll see with our clients, is when they sit down into a chair and get out of a chair, do you often hear them go, huh, and they sort of collapse into the chair, or they go, huh, to get back up out of the chair. That's a Valsalva's maneuver. That's a suboptimal strategy. That means they're bearing down. Another sign that your client is not using their core well and that they're bearing down is you often see this distended abdomen look. You know, you see a big belly, even in clients that aren't heavy or overweight. It's a distended abdomen, and if you touch it, it feels rock hard. There's another sign that your client is not using their core well, and they're not using a good or optimal strategy. Hello, my friend Rahul from India, my good friend and part of our Integrative Movement System specialist community. Thank you so much for being on, all the way over from India. Another sign that your client may not have an optimal core strategy is how they breathe. They often breathe shallow, they often breathe rapid, and they often are belly breathers. So you see them, if you watch them quietly breathing, they're breathing here. Both are suboptimal strategies for breathing. So belly breathing is not optimal breathing. Using your entire thoracolpelvic cylinder from your first rib all the way down to the pelvis is the way to optimally breathe. All the way from top to bottom, from side to side, as well as front to back. That is three-dimensional breathing. That is diaphragmatic breathing, or using the diaphragm appropriately. So another easy sign. Another easy assessment to do, we'll do it right now. You can do it with your clients starting today and or tomorrow when you're working with your clients, is have your client lie down on a table and or floor and watch what happens when they either elevate their legs and or elevate their head. So let me show you what this looks like. So what you're going to look for is when your clients are lying on the table or on the floor, what you want them to do is just lift their head up and then just feel or look, observe what happens to their abdomen. Does it distend? Does it bulge out? Do they over-recruit their neck muscles to do it? Another common sign of suboptimal core strategy. Then, a higher level assessment is have your client bring one leg up and bring the second leg up and see what happens to their core. Do they distend? Can they still talk to you? Or do you see this red face? They're holding their breath, they're shaking, they're having low back discomfort. So super easy assessment, because what should happen when your clients are lifting their legs from the supine position is the abdominal wall activates, but they should not flatten, they should not arch, they should not hold their breath, they should not distend their abdomen. So super simple, easy assessment to do to see how well your client's core function, or how their core is functioning. And then also, it also tells you that should your client be doing supine exercises with their legs elevated if they can't even maintain that position. So now that you've done your assessment, how do you help your client develop a more optimal strategy? Rahul, you know the answer to that. The number one strategy we have for helping our client develop a more optimal strategy through our corrective exercise strategy is to have your clients start to breathe three-dimensionally. And one of the things we need to have our clients do is use more of their cylinder, so the thoracolpelvic cylinder, the thorax over top of the pelvis, in that breathing process. So we want to teach our clients how to breathe, not just belly breathe. In fact, most of our older clients need to stop belly breathing so much. They need to breathe more through their nose, less through their mouth, and breathe more into their rib cage. So I'm going to do it with my hands. You can also use a strap for clients that don't have great range of motion of the shoulders. And what you're going to notice is as I breathe, I'm going to breathe through my nose. You see the expansion of my rib cage, and then as I breathe out, watch how the ribs come back down together. Not pulling the abs in, just using breath. So breathing in through the nose and breathing out through the nose. Now watch my thumbs. It's also important to have your clients breathe laterally and posteriorly, because this is an area where a lot of your clients will struggle, and this is oftentimes why your client ends up in this position, because they're not able to breathe to elongate their spine. So watch my thumbs back here. So hopefully you can see that my thumbs were expanding out and laterally, because we want our clients to breathe all the way around their cylinder. That's that three-dimensional breathing, or using their diaphragm, which attaches all the way around the rib cage. That's how you use and utilize that diaphragm in the most appropriate manner. So three-dimensional breathing is the first strategy. Now obviously you need to teach your client how to incorporate this into some of their functional patterns. So let me bring you back here. What we're going to do now is take a look at some of our patterns, just a couple examples. We'll look at a pushing and pulling pattern, because one of the things our clients will often tell us, they'll say, hey, you know what, I need to work my core. I need to do crunches, leg lifts, because that's what they're looking at online, or they've been conditioned to do. And it's like, that's not what the core is supposed to do, right? Lie supine and lift your legs. And like I said, a lot of our clients can't even do that when they're lying supine. So a couple great patterns is really suspension, row, and or push-ups. So I'll demonstrate both those, because again, it's really just the same concept taking into functional pushing and pulling patterns, which are some of your best core exercises. We're always going to start with good alignment. Let me back you up here a little bit. We're always going to start with optimal alignment, and that's imagining as if the client is being pulled up from the backside of their head and neck. So from the side, backside of the head and neck, the ribs stay down in the front. So again, we don't want our clients like this, because a lot of our clients, our older clients, they're already like this because of things like spinal stenosis. That's why it's important to understand spinal stenosis, because spinal stenosis changes your client's posture, it changes their strategy, it also changes their ability to use their core in an appropriate manner. So what we want to do is, again, align, stack that rib cage over top of the pelvis. Now we're going to do a pull. So again, we want to make sure that in this pattern, we're maintaining that same alignment. So we're breathing in as we pull, breathe out as we release. Breathe in. So again, now we're training the back muscles, the extensor muscles, or the pulling muscles. However, we're still maintaining breathing. We're still maintaining that thoraco-pelvic cylinder alignment. So a great way to incorporate three-dimensional breathing into a functional pulling pattern. Okay? We can also do this with a fallout pattern, which is basically the exact opposite, or a push-up pattern, basically the same concept in the exact opposite manner. So let me show you what that looks like. So same idea, long spine, like you're being pulled up from the back side of the head and neck, ribs are down, we're gonna grab the handles, and now it's the same idea. So long spine, step back, you're gonna breathe in, and as you breathe out, arms go up overhead. Breathing in, breathing out. And again, if your client is doing this well, they should feel activation underneath their shoulders all the way down into their core. Because again, what the core muscles are designed to do is to maintain the rib cage over top the pelvis and to control this position, whether you're doing a bilateral pattern, which I just showed you, or even unilateral pattern, where now these muscles are rotating and controlling rotation. So just easy ways to incorporate three-dimensional breathing, the number one strategy for improving core function and posture and optimal core function, and then use that concept through your functional exercise progressions. Watch your client's alignment, watch their breathing, watch their strategy. Are they struggling? Are their faces turning red? Or are they able to maintain alignment, maintain relative three-dimensional breathing, and still maintain their range of motion? So check their range of motion before and after their exercise. Make sure they're using an optimal core strategy, and that's how you use your process. Intake, functional goals, you assess, you address, and then you progress your clients into the functional exercise patterns to incorporate the more optimal habits into their movement strategy so that they can do the things they need to, want to, and ultimately return to or achieve those things that they love to do. And that's how you differentiate yourself from the rest of the industry, become an industry expert, and help enroll people into your programs. This is Dr. Evan Osar. And if you're looking for more information about how to use a strategic, sustainable, and repeatable process, join us this Friday. We're starting a brand new IMS Foundations. IMS Foundations is the beginning of the integrative movement system process. We teach you assessments for the core. We teach you assessments for the hip and shoulder. We teach you how to use your assessments to drive your corrective exercise strategies, and then how to incorporate this into the functional exercise progressions: squatting, lunging, bending, rotating, pushing, pulling, gait, balance, and carry, so that way you can successfully progress your clients towards achieving their functional goals. We've got CCs with this program. We're going to teach you how to differentiate yourself, how to attract more individuals with your information, how to apply this information to yourself, so that way you can easily relay this information to your clients and your potential clients, because we want you to be successful with this information so that you can attract more individuals and really show your clients, your community, and your potential clients why you're different from the rest of the noise in the industry. So we'd love to have you join us in this IMS Foundations program. It's all online. It's 4 hours this Friday, next Friday, and the following Friday. All sessions are recorded in case you can't be on live. There's homework, so that way we make sure that you're doing the work and that you're incorporating this information into your own programs. We look forward to seeing you this Friday. We'd love to have you. If you have any questions, Mary will put the link next to this video here. Reach out. You can contact us through this website and or reach out to Mary at helpdesk@fitnesseducationseminars.com. Hey Damien, good to see you, my friend. He's part of our Two Anatomy Geeks community. He understands the integrated movement system and uses it with his clients as well. So thank you so much for all you guys do, for sharing this information with your like-minded colleagues. We look forward to seeing you this Friday. Any questions? Feel free to reach out. This is Dr. Evan Osar with the Integrative Movement System. We'll see you next time. Continue to be that leader for your current community. Be that light for your clients. Find ways to bring them together, to show them a better way for posture, for movement, and for achieving their goals. Give them that ability to just have a point in their day where they can just let all the noise go, to be connected to their body, to be connected with you, to be connected to their source, so that way we can definitely, and I believe, change the world. Thanks so much for all you do. If there's anything we can do to help you, reach out. Take care. We look forward to seeing you, hopefully, in IMS Foundations. And if not, we'll see you next time at Integrative Movement Insider. Take care.